Hello, my name is Luella Thompson, and today I will be presenting my service learning experience. I completed 4 hours of service with the call, also known as the Children of Arkansas Loved for a Lifetime. My role was helping organize and sort donations that directly support foster families and kinship caregivers, including elderly grandparents raising grandchildren. So, the Call is a nonprofit organization that works to recruit, train, and support foster and adoptive families across Arkansas. They provide not only training and emotional support, but also practical resources like clothing, household items, baby gear, toys, and school supplies. I volunteered at the Little Rock location on the 22nd of September. So the populations served include foster children, foster families, and kinship caregivers, many of whom are grandparents stepping in to raise their grandchildren. During my time at the Call, I assisted by sorting and organizing donated items such as clothing, baby gear, a lot of household items, toys, and school supplies. By keeping the donation center organized and accessible, I helped ensure families could quickly find what they need. This behind the scenes work directly supports caregivers, including elderly grandparents, by saving them time and stress when accessing the resources. This can be challenging, especially if you are thrown into it and you just need some immediate resources and immediate help. They are able to keep inventory, have an idea, and it organized to where they get a call. Hey, I need these items. Hey, we have these items, and everything is arranged as efficiently as it can. And it really helps take the toll off of, children that have to adapt. So once a social determinant of health I observed was economic stability, which is one of the 5 domains listed in Healthy People 2030. Many grandparents raising grandchildren live on fixed incomes, such as Social Security or retirement benefits, government assistance. So taking in children often creates unexpected financial strain. The Call helps address this determinant by providing free essential items that reduce the economic burden on these families. And how does SDOH is being addressed? So at the Call, this need was met through donations of clothing, toys, household items, school supplies, you name it, they probably have it. They sort and organize. So these resources allow grandparents and other caregivers to meet their grandchildren's needs without facing additional out-of-pocket costs. This support helps reduce financial stress, promotes stability in foster and kinship placements, and allows caregivers to focus on providing love, security, and emotional care for the children. Other community resources, such as the Area Agency on Aging, which offers services such as support groups, respite care, and sometimes financial assistance for grandparents raising grandchildren. Supplemental nutrition assistance programs like SNAP, WIC, which provide nutrition assistance that helps families stretch their limited income. These resources, along with organizations like the Call, create a strong safety net for grandparents caring for grandchildren. Although that day I was not working directly with the families, my contribution had an impact, I feel. By organizing and preparing supplies, I made it easier for grandparents and families to quickly find the items they needed. Like I said, giving them the efficiency to be able to care for these children in these, very stressful times. This reduces the stress and supports the dignity of families who rely on the Call during difficult times. I learned that even indirect service like sorting donations play a vital role in helping others. My biggest takeaway for this experience is recognizing the challenges elderly grandparents face when stepping into a caregiving role. They often balance their own health needs and limited financial resources while raising children who require clothing, school supplies, daily care. The older they get, extracurriculars, the older they get, the more expensive they get. This experience reminded me that as a future nurse, I need to assess not just medical conditions, but also the social determinants of health that impact patients' lives. Community partnerships like those fostered by the Call are crucial in supporting both children and caregivers. So, thank you for listening to my presentation on my service learning experience at the call. This opportunity allowed me to see how community resources directly reduce barriers and improve stability for families, especially elderly grandparents raising grandchildren.